When the neck moves rapidly back and forth, whiplash may occur. An estimated 20% of people involved in rear-end collisions later experience symptoms in the neck region. Car accidents remain the most common cause of whiplash. However, whiplash may also occur from sporting activities, falling, and other types of trauma. Although most people recover quickly, anytime an injury involves the neck region, a patient should get an evaluation from a neck orthopedic specialist. Common symptoms of whiplash include dizziness, fatigue, neck pain and stiffness, decreased range of motion in the neck, and tingling or numbness in the arms. Less common potential side effects include blurred vision, ringing in the ears, depression, memory issues, and irritability. After a spinal physician evaluates the patient and determines the patient has whiplash, they suggest a variety of conservative treatments. Physicians suggest icing the neck for 15 minutes every 3 hours for 2 to 3 days. The doctor may also prescribe painkillers or non-steroidal anti-inflammatory medications to reduce swelling and decrease pain. For more serious instances of whiplash, the physician may suggest a neck brace or collar to stabilize the neck. Whiplash does not require surgery.